Hey, David.
Hey, Laura.
Question for you.
Okay.
When is the last time you went for a checkup?
Oh, don't ask me that. I'm in the process of getting a new internist physician, so it's been a while.
Been a little bit.
It's been a while.
Okay. Well, I went this past spring.
Oh, good.
And everything was, pretty much okay, except my cholesterol keeps edging up a little bit. To that borderline level, I remember getting on the Google.
Oh, Dr. Google?
I know. After my last visit, and I stumbled across this report from the CDC, and it was, it wasn't like totally current. It was like 2018 or something like that. But it said more than half, so that's over 50% of adults in the United States had at least one of the top 10 chronic conditions. So like high blood pressure, diabetes, heart disease, kidney disease, cancer, things like that. And 27% of adults had at least two.
Oh my goodness.
Which I just found that like a lot.
So that's still over a half of the half.
Right. I don't know. And it kind of kept me up a little bit at night because health is also intergenerational, right? Meaning, I feel like the health of our children and our future. So if this keeps going up for adults, right? And a lot of health and genetics or whatever is kind of intergenerational, our future is kind of at stake, right?
Well, and this has been rising in kids too, right? Like we've been seeing a lot more kids who are coming in with like asthma, obesity, diabetes, chronic pain, mental illness. Like this is also affecting children.
For sure. And to add to that, have you heard this? This was new to me this year, it's probably been around for a long time, but it was new to me. The term ACE or adverse child event.
I learned about ACEs from a previous episode when we had Dr. Heidi Sally explain ACEs to us.
Right. She did talk about that. Well, I've been reading this book, which is really good, and it centers around trauma. And apparently 70% of Americans have had at least one adverse childhood event.
So can you remind us what is like an example of an adverse childhood event?
It's anything that causes damage to your mind, your body, your spirit. It can be anything. It can be, abuse. It could be poverty. It could be divorce. It can be anything like that. And these ACEs affect our hormones. They affect our immune system. And the higher your ACE score or numbers of events that you've had in your life, the higher risk you are for chronic disease and depression and autoimmune disease. And it affects developing brains and bodies even more so, and your structure and your function and your things like that. So that makes me a little nervous for kids.
That's wild. Well, speaking of the Dr. Sally episode, I also remember she said that in the pediatrician office where she's the head doctor there, she and her team find themselves writing more prescriptions for, was it SSRIs? Those are like antidepressants and those kinds of things. She writes more prescriptions for that than what we would generally think of prescriptions for children who have more like a physical ailment, like, for having like a cold or a flu or something like that. So I guess it's kind of like we need to start looking about more of these holistic and preventative approaches for care that are affecting mind, body, and spirit, to your point.
Yeah, for sure. I know that really opened my eyes or ears when she talked about that. And, the typical curriculum and most residency trainings do not have a strong emphasis on preventative or holistic health at all. It's more reactive medicine care. However, we at SSM Health Cardinal Glennon have one physician. One. In all of SSM St. Louis who represents an evolution in pediatric care. And her name is Dr. Anu French. And she is a mom. I've known Anu for a few years, and she's a mom. She's a doctor. She's also a musician.
Wow.
And an artist. Yes, and a really, really strong advocate. She is a fellow of the American Academy of Pediatrics. She is a member of the American Academy of Pediatrics Pediatric Integrative Medicine Leadership Initiative, and she is double board certified in pediatrics and integrative medicine.
That's a lot of titles and responsibility and schooling.
It surely
she's
is.
very, very smart and creative person. Can you kind of remind us or tell us what integrative medicine means?
Yes, I'm very excited about this. So pediatric integrative medicine, it's a specialty. It's kind of like a hybrid that blends conventional medicine with evidence-based complementary therapies. And it's really an emerging field that considers the whole child, mind, body, and spirit, and includes all elements of lifestyle and family health.
Wow. So I guess that makes me think, like, we talk about mindfulness, like here, even at SSM Health. So it sounds like that needs to be applied to the pediatric realm or to our kids as well, right?
For sure. I mean, it kind of seems, just with all of the trends going on, that it's the model of medicine that is really kind of tailored for the children of today and what they're facing. And kids are totally resilient, and there are lots of things, especially when we learn to do them in an early age, that can build resilience. Plus, knowing those things and knowing those techniques is empowering, and we need to start building intergenerational resilience too, right? Start sooner if we want to make any attempts at really breaking the cycle of all this, I feel like. So Dr. French's practice is very, very unique. It's accessible, it's affordable, it's equitable, it's trauma-informed pediatric integrative medicine, and it's also an integrative psychiatry practice. And she is truly on a mission to create healthier communities through healthier kids. And her one-of-a-kindness is her Glennon Factor, truly. And I'm excited to have her on and hopefully spread awareness of her specialty, because we just need more of her. We need more, more than just her.
I can imagine she's very busy as it is.
Yeah. And then I'm excited because she's actually bringing one of her families with her, one of her patient families. And so we're going to have Siler and his mom on as part of the podcast too. And his mom's name is Stacey, and they're going to share their journey with us along with Dr. French. And we're all going to learn a lot.
I'm excited to learn a lot, and I can't wait to hear the patient family's perspective about integrative medicine, because it's all so fascinating.
Welcome, Dr. French, Siler.
That's her.
Stacy. Yes. No, no.
You're going to keep us on our toes today, aren't you, Siler?
I mean, if you can do that on the chair, sure.
Don't tempt me.
Well, thank you all for being here today. We're going to start with you, Dr. French. You first. So, Dr. French, you have been a Glennon pediatrician for how many years now?
Well, approaching 25.
25, wow. And you're
That's
only
awesome.
26 years
Yeah,
old.
that's it, yeah.
Right.
Started when I was 1.
Yes.
Wait a minute.
Yes.
I was about to say.
But at some point, you discovered a motivation to study integrative medicine. So tell me about that. What motivated you to do that and pursue that piece?
I think there's always a story of personal healing, right? A journey. And I'm approaching 30 years in practice, but 15 years ago, I was burned out completely, professionally and personally. And I was sick. I had a lot of chronic illness, and I had 2 little girls who also had some chronic illness. And I was really looking for another way to do it. I was getting a little bit bored of the revolving door of pediatric illness and just the lack of work-life balance. And this email came into my spam folder, from the Andrew Weil Center for Integrative Medicine for a fellowship in integrative medicine. And I thought, well, I'm just going to do it. I didn't really plan on whether I was going to practice it, but I said, I need to find some other tools in the toolbox. And so that's really what started the journey. Doing the fellowship, getting board certified, and then just my world, expanded exponentially, because I met all these amazing teachers and mentors and pioneers and people really seeking a different way of practicing medicine. And it was fantastic. And, the journey still continues.
So, how did what you learned impact your own life? Like before you started applying it to others. So,
I really cleaned up my life. Let's just put it that way. I just started to eat better and sleep better and be more mindful of self-care and just move my body more, and just some of the basic principles of integrative medicine. And also started taking care of myself, because I just kind of realized that I can't be a good doctor and I can't be a good mother if I wasn't taking care of myself. You just don't have enough to give if you don't take care of yourself. And so that concept was really almost radical at the time, when I was burned out, because that was why I was burned out. And then, bringing that into my home first, with my own children, and learning about ACEs, adverse childhood events, and building intergenerational resilience. But starting at home with me and my own children, and then bringing that into the office, and, bringing it into families, and building intergenerational resilience between caregivers and their children. And then kind of just seeing that ripple effect from there. So that was really how it sort of started. And it was just little things that you start at home with, spending time mindfully with your own children, learning how to put healthy boundaries down with work and family, just cleaning up the diet. You think you're eating healthy. Everybody thinks they're eating healthy, correct? And then you're like, oh, maybe I'm not eating that healthy. And prioritizing things like sleep and movement and mindfulness within my own life, and then bringing it into the practice.
So you mentioned like there's some basic principles to integrative medicine, but is there like a set of, I guess, like core principles to what some of those are for integrative medicine? Can you kind of share that with us?
Pretend we don't know, because guess what? We don't.
And I don't, because I'm not a medical person, so I'm curious.
Well, I actually printed out the definition from Dr. Andrew Weil, because I really wanted to make sure I was not paraphrasing this, because this is an important definition that Dr. Andrew Weil is kind of like the grandfather of integrative medicine, really introduced this concept, and his center in Tucson is really the gold standard for this. And so his definition is that integrative medicine is a healing-oriented medicine that takes account of the whole person, and I would say whole child, body, mind, and spirit, including all aspects of lifestyle. It emphasizes the therapeutic relationship and makes use of all appropriate therapies, both conventional and alternative. And it's a partnership between the patient and the practitioner in a healing process. And it's an appropriate use of conventional and alternative methods to facilitate the body's innate healing response. And it's important that it considers all factors that influence health, wellness, and disease, including mind, spirit, and community, as well as body. But the philosophy doesn't reject conventional medicine. That's very important, nor accept alternative therapies uncritically. So that's very important. And it just recognizes that good medicine is based in good science and should be inquiry-driven and open to new paradigms. And we try to use natural, effective, less invasive interventions when possible, but we're also focusing on broader concepts of promotion of health and prevention of illness, as well as treatment of disease, and then training the next generation to be models of health and healing, because we're committed to the process of self-exploration and self-development ourselves. So this is what Dr. Andrew Weil defines as integrative medicine. And the section on integrative medicine through the American Academy of Pediatrics takes from this definition, and really they have a beautiful graphic up there, and it really focuses on the 6 tenets of health, and we're talking about nutrition and sleep and exercise and mind-body medicine and feeding the spirit and community. So, just all of that being really kind of the basic foundation for any treatment plan that we bring into our office.
So I feel like traditional, conventional, I'm not which sure is the right term, but conventional medicine looks a lot at symptoms, and this is maybe looking more at like root causes and things like that. I was reading this book on, well, I'm still reading it, I'm not through it, but reading this book on trauma recently, and it was talking about, instead of asking people what's wrong with you, what happened to you. And I feel like this is kind of like that. So it's really, integrative medicine is really approaching more from a root cause and delving deep in to that, instead of having a revolving door of symptoms, right? That just keep coming back because we're treating symptoms. So what are some of the patients that come to your office? Like, what are some of the chief complaints, unresolved complaints maybe, that you see a lot of?
I would say mental health, would be the number one reason that families find us. And that shows up in so many different ways. I think I see a lot of children who are on the spectrum, who are neurodivergent. Mm-hmm. We see a fair number of children who have a condition called PANDAS, which is where you get an infection which affects the brain and causes like a symptom complex of anxiety and OCD and
have to do with pandas.
Tics and so on. Yes, exactly. Yeah. So, why is it called that? Is that what you asked?
Yeah, why is it called pandas if there's nothing to do with pandas? Where's my pandas?
The definition is, pediatric acute neuropsychiatric disease associated with. So it's pandas.
It's a nice acronym.
Yeah. Pediatric acute neuropsychiatric syndrome.
Has nothing to do with the endangered animals in Asia.
Not as cute as you were hoping.
That was Panda.
And we see a lot of children with complex chronic illness, with symptoms that aren't getting better and are affecting their quality of life, whether it be headaches or tummy aches or chronic pain, chronic fatigue, and things like that. So that we do, I definitely have a heavy patient load of families that have children who are very sick and who are also really seeking answers, who are frustrated and tired and scared. Yeah.
Looking for something that's more than just like a Band-Aid for a headache. Like when I get a headache, I take Tylenol, but it could be something more at the root cause, like what you were saying.
So you said this style of medicine is approved by the American Academy of Pediatrics, just this whole focus on more preventative in mind and body and spirit and all aspects of lifestyle and things like that. Why do you see this as an ever-growing, I do anyway, ever-growing need in pediatrics? You mentioned adverse child events, and I feel like that is an underrated topic.
Yeah.
And we're seeing more of that. So
yeah, I think since the pandemic specifically, we've seen just an epidemic of chronic disease in children. And there's a very interesting, there's a branch of the NIH called the NCCIH. It's the National Center for Complementary and Integrative Health. And they track data. And what's really interesting is that steadily over the last several years, about 12% of families with children are using complementary and alternative methods of healing. That's 1 in 9 children, and that number goes up dramatically if you have a chronically ill child, almost more than 50%. And about 60% of these families are not telling their physicians that they're using these remedies, but they're widely used. And things like, supplements and chiropractic care and yoga and acupuncture and homeopathy and so many of these things that are being used. So there's a huge demand for it. And there's a huge thirst for people seeking this kind of treatment which addresses the whole child and the whole family. But when we're talking about traumatic events or experiences, they adversely affect inflammation in the body, and that leads to chronic illness. And so anything that we can do to improve the resilience of the child and the family as a unit, and anything that we can do to decrease inflammation in the body is going to tremendously help prevent disease and also treat symptoms by addressing them at the root cause.
So you said that there's a huge demand. Like, can you kind of tell us what, like, are people just trying to knock your door down? It's like, I need an appointment. Like, what is that? Exactly. Like, what's that like?
it's so interesting because, it's been such an organic process, when I kind of ventured into this field, in 2011, 2012 was when I decided to do the fellowship, and then I did the fellowship, and then I started to bring it into practice, and it was just, a few things here and there. I'd be like, would you like to try some probiotics with your antibiotics? Let's check your vitamin D levels. Let's clean up how you eat. Let's talk a little bit more about how you sleep. And here's a supplement that has some evidence behind it. But, just word of mouth is how the practice grew, and I do want to give a shout out to my wonderful team at the Pediatric Integrative Medicine office at DePaul Health Center, Amy, nurse practitioner, two wonderful nurses, Robin and our charge nurse Josie, and our front desk information specialist Raven, and Melanie, our clinical manager. But just because without them, we wouldn't be able to do any of this amazing work. But we just started seeing word of mouth, referrals, family to family to family. And then now more recently, we've been getting more referrals from the community practitioners and physicians. But it's usually, we have an intake process because our demand kind of we had to actually close down our taking new patients for a couple of years because we had this wait list of 500 people and we were just struggling. Then the pandemic hit and then it was just crazy. And now we have, a form that you fill out and send in, and then we kind of do an intake process. So we see patients based on need. Acuity as opposed to when you send it, because we're really trying to prioritize. So that's how it works right now. It is, we still definitely have a lot more demand than so.
500 wait list is a lot.
Yeah, that's a lot.
It took a couple of years to clear it. Yeah.
So, are you okay?
Which is why it's so important.
Oh, you're checking on her.
Thank you.
Love
it's
that.
just, yes. Some days
I need her for my medicine.
just the balance of my, work-life balance. Yeah, it's constant work in progress, right? It's always trying to make sure we're taking care of ourselves. And I think it's really practicing what we preach, truly. I mean, that's not a cliche here.
So we're going to pivot to Stacy and Siler for a minute.
So much
hey,
to say.
You made it past the wait list. Like
I did.
And by Stacy and Syler, you mean just me.
Did.
I do have to
That's good.
tell you that when I filled out the forms to try to see Dr. French, I was going down the list and I was checking so many boxes of, does your child have this? Does your child have this? And I remember thinking, she's going to think I'm just checking boxes because I want to get into the clinic. And I checked so many boxes of what the criteria was. And I don't know if you remember this, but at the top of Siler's form, I wrote, help us. We were so needing help.
So when and how, let's go back. When and how did you meet Dr. French, and why did you seek her out? What was going on with Siler? What was going on in life?
So it did kind of start first of all, I guess we should talk about Siler being on the autism spectrum. So that's just
I am?
something that we, had been working with. He got diagnosed actually at Knights of Columbus at 3 years old here. And then we had traveled. We ended up going to San Diego and moved over there for a while, where he was treated with an integrative medicine doctor out there. And then we came back and things were, going okay. He was doing well. And then during the pandemic, he started telling me that he was feeling some depression, which I was really proud of him for being able to, tell me.
Good on you for
that.
verbalizing that.
Yeah.
Thank you.
And of course he was home all the time.
Verbalize things for a reward. Camel, 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 camel.
So, and that's kind of when things started escalating. He started having some depression, some anxiety, some extreme anxiety, some panic
Really
attacks.
extreme anxiety.
And we went and saw his pediatrician, who we love, and tried to help with some medication for him. It just didn't seem to be working. I think the pinnacle was when we went in for a well child exam, and he needed some vaccines for his year, and he had a extreme panic attack that lasted for about an hour. The ambulance was called when we were trying to get home, and I just, at that point, I was like, this isn't great. This isn't working. Our family was in crisis. And,
Really? You don't say.
And both Siler and I said at different parts during that year, like, I don't think this family's working.
Wow.
And so looking back in the past where he had been treated different outside of conventional medicine in the past for some stuff, I thought, I'm going to figure out who we can go see. So I actually did some checking around and then found Dr. French's name and tried to make an appointment. And the wait list was closed. I was in November and I said, when can I call back? And they said, after the new year. And so I called back in January and got the paperwork and said, help us. and was able to get in.
Okay, so enter Dr. French. So you got in.
We got in.
Got in the door.
Yeah.
Okay, so between the two of you, what happened? And how did we get to the bottom?
Well, it was an interesting first visit. I'm sure Dr. French remembers. And right from that first visit, I remember thinking, okay, this is going to be different than what we've done before. I actually brought my father with me because I wasn't sure if I would need help, physical help with Siler, because
my mom needed your dad.
I needed my dad because his panic attack, like that had just happened a few months before. He's not 3 anymore. It's hard for me to make sure he was safe and stuff like that. So I brought my dad with me, and we got in there and we met Dr. French. And I knew, so I'm in the medical field. I'm an RN, and I work with traditional medicine. I actually work at SSM at St. Mary's. And so I did want that traditional medicine, but I also wanted the integrative part of it. And being a medical person, I knew some medical things, but not to the extent that a physician knows it. So, my method of coping with stress and things is try to read as much as I can and educate myself as much as I can, but I don't understand the whole complexities and the whole picture of it like a physician can. So I remember just going and knowing of these things that I should be worrying about, or knowing of these things that I had heard about, but I didn't really know about. And she was talking about all of those things. And I just remember feeling like I just put this huge burden off of my shoulders, and I gave it to her and she took it.
I do remember Siler very well at that first appointment, and
I was about to say, yeah, I'm right here. Of course you remember me well.
Yeah. But I remember how, there was a sudden distrust, and I loved his sense of humor right away because I was talking to him. We always try to make families feel seen and heard and affirmed, give space for them to tell us their journey, and know that we believe them. And I was using some of my motivational, interviewing techniques. And I remember Siler saying, so is this reverse psychology?
He's got you found out,
yeah,
Dr.
I was
French.
like, wow, this kid saw right through me at the first visit. But I do
Nah.
remember how afraid he was and how distrustful he was, and how, and I also was so impressed with Stacey because she had, done all this research and was really, doing the best she could with, she had experience with a different integrative doctor. And so she was taking all of that and she had read about it and she was trying to apply it. And I just felt like this is the perfect family to show up at our office, because the principle of integrative medicine is to empower the child and the family to believe that they have the tools to heal. And so it's a partnership. It's a very powerful triad of the clinician, the child, and the caregiver. And I thought, well, we're already off to a good start here. But I do remember how afraid he was and how distrustful he was. And I knew that my first job was not to re-traumatize, and also to make sure that he understood that this was a safe space, because we weren't going to really be able to do anything without gaining Siler's trust. And so I think that was the main focus, I think, of the first visit, to not just to take in all the information that they had brought and on all the goals for treatment and all the, obviously the medical details, but also just really understanding that, we needed to gain his trust and his interest in what needs to be done. And I would say the first couple of visits, Siler wasn't really on board at all. He was like, "Oh my
Very
gosh."
suspicious.
I wasn't on a board. I was on a floor. Get it right.
Yeah, I remember you sitting on the little chair also. Like we have like sort of a little kindergarten or Montessori chair, and I remember sitting on that chair the first couple of times, almost like, like I don't really want to be here. I don't want to be part of this conversation.
I was like a
Rolled
cat.
over, protective of his.
Yeah.
I don't know where it was that I found this when I don't know if I was on your website, Dr. French, or something, but somewhere in my search, a description of your office says that you're a trauma-informed office. So talk to me about that just a little bit, and then we're going to get back to that first visit. But like you talked about that you didn't want to re-traumatize him,
Right.
that he brought that to the table and he's seeming suspicious. So what does that mean to have a trauma-informed office?
Well, I mean, the first thing is the intake form. So that's why we have that form, so that we can address some of that. We don't bring up all the, the experiences that the family and the child have had. We don't talk about those at all. So because we don't really want to bring it all up and kind of stir the pot again. So that's one of the first things. The second thing is also just, it's how we approach. I always walk in and I always talk about how it's a safe space, and that if you feel uncomfortable, please speak up. And if you disagree with something that's being said, please, speak up. So I just really, especially if the child's obviously developmentally, able to understand the conversation and so on. And we also make sure that, we're engaging the family in the process, the treatment plan. And that's kind of the motivational pieces of, what's going to work best for your family. I really come into the room with a blank slate. I do not have an agenda, which makes this a little challenging sometimes because there is no cookie cutter approach, but I really I have a mindful moment when I wash my hands, which is like a really, I truly believe that this is a holy encounter. I really believe that every moment I am the privileged one, right? Because the healing goes both ways. And so there's a moment of just quiet when I'm washing my hands where I'm just like really cleaning the slate. Like I don't have any agenda. There's nothing premeditated. There's no plan. There's nothing. I'm just really going to listen to what the family wants and what they're looking for and how they think they're going to get there. And that to me is like the most important piece of trauma-informed care.
Which I think is so interesting, because if you think about conventional medicine, there's a plan, right? Or I mean, most of the time there's a plan. Like, they're
There's a book
coming
about
in
it.
with ABC. The traditional approach to this would be to do ABC, but this is so different. I don't know, to me, like, I like control. So this would be very intimidating. Like, I have nothing. I'm going in with a blank slate. I don't know what I'm going to expect. I mean, you have to be a certain personality to be able to have that approach, right?
I think it works so well with the Glennon spirit, though, right? The Glennon mission is through our exceptional healthcare services.
There's ghosts in the building?
We believe in presence, and so I think it just, for me, it's the perfect fit because, it is the understanding that the guidance is coming from beyond, and the guidance is something that's for all of us. Like, it's a team approach, and we really, the input of the patient and the family is crucial. In that moment. And so I just have complete faith and surrender really in that moment that plan will evolve. May not at the first visit as we saw, or maybe not even at the second visit as we saw with Siler, because he was just, even I remember the second or even the third visit, he was just really like, I don't know about this Dr. French. And, but, we eventually got to a point where he got to a point where he was really on board.
So you have a few appointments. So how long does it take? I know it's different. It's not cookie cutter, but in your instance, how long did it take to kind of come up with a plan? Or is the plan ever evolving, right?
I'd say the plan is still in
Yeah,
process.
unfolding.
Yeah,
Yeah, sure.
Because things are still, evolving and processing with him as we go down the path, but it was a little bit of a delay with Siler just because of his fear, his anxiety. And Dr. French was so good at, being gentle and gaining his trust. And it was a safe space for all of us, safe space for him, safe space for me, because I felt like I could, say what I wanted to say and ask for what I wanted, what was important to me. And I knew it wouldn't be rejected or, brushed aside like it might be in a traditional setting. So she gained my trust very quickly, but Siler did take a little bit longer, and we just kind of worked on things as we could until we could get to the point where we could get some lab work for him. And then once we got the lab work, then, it's just a constant tweaking and trying things and
right. It took
finding
a
what
little bit
works.
of time to get the blood work because of the fear. I mean, there was just panic, just to even come and see a doctor.
For context, I have a
alone-
fear of syringes.
Yeah.
Yeah.
And it was a logical, rational fear of a needle, of pain, of the unknown, of uncertainty. And so once we got that, then we got so many answers. And then we also came up, Stacey had already come to me with some ideas because she had tried some things and some things at work and some. So we took that plan as a foundation, and then we had some lab work, and then we found some nutritional deficiencies. We found some chronic infections. We found some root causes that we were able to treat very effectively. And then, I loved that moment when Siler, kind of took charge and said, you know what, well,
Yeah,
this
I took
is
over the hospital. Y'all bow to me now.
yeah, and I love that analogy of like the bus where we're driving and then we're like, okay, well, Siler needs to take over the driver's seat of his care, and what he did, and he started to be like, well, this is working and this is not working, and I want to do this and I don't want to do this.
And then I crashed the bus at the end.
And then we just, it was wonderful, just to see that process.
And you talk about supporting the family and teaching the family. That was something, as a mom with a child on the spectrum since they're 3, you kind of just get used to running the show, and this is what we need to do, and I understand this. And obviously when they're little, they don't understand, and it's hard. You get to a point where that's just how you survive, how you work with things. But when we went to see Dr. French, like I said, the very first visit, I was like, oh, this is going to be different. He's a member of this team. He's also going to help determine, like how his healthcare goes. That taught me, outside of his medical care, that taught me just being his mom, transitioning to having a teenager, that, it's a different kind of momming than you do when they're little. And so that really, it went all through our home life and our
Not
family.
really. As a baby, all you do is poop, complain, and whine. As a teenager, you poop, complain, and whine. So it's the same.
Not much different there.
Not much different.
There's a lot of medical things that you're still referring to, like when you're talking about lab work and being able to find out specific things. I know that integrative medicine is it's a blend of like traditional medicine and holistic approaches, but how much of it is actually talked about in medical school? I mean, like, do they talk about some of these integrative and holistic concepts in medical school currently, or what is that like?
Yeah, and I think things have come a long way. They have the academic consortium of integrative health, and I think there are about 75 healthcare institutions and nursing schools and educational facilities that are part of that, and their entire intention is to promote the principles of integrative health in an educational setting and to really build sustainable models of healthcare and inform healthcare policy. So it's, really far-reaching. The Andrew Weil Center for Integrative Medicine has the IMR program, so Integrative Medicine in Residency. And I was very fortunate through the Glennon Foundation many years ago. I might be wrong if it was Dan Buck.
Probably
Could-
not wrong.
Not wrong. Okay.
Yeah.
But I went to meet him because I wanted to be part of the pilot of the program at that time, and he wrote me a check. I was there for a 15-minute meeting, became 2 hours. But once I get on my soapbox, it's hard for me to stop about integrative medicine. But we got a grant through the Glennon Foundation to be part of the pilot. And so 3 of our residents trained. They came and did the 1-month community elective with me, where we were building the curriculum for that. So now that's well established in several residency programs across the country. It's called Integrative Medicine in Residency. And then they also have the IMER, which is the Integrative Medicine Elective Rotation. And that's for medical students and residents to go and spend some time at the Andrew Weil Center and actually do a month of training. So they're really trying to bring it into training, So unlike me, who 15 years into practice burned out, went back and did the fellowship training, which is available which is also it's a 1,000-hour, 2-year fellowship program. And it's teaching you, how to be an integrative doctor. And then there's a board certification in that. So it's very evidence-based and structured. But they're really trying to bring this into foundational medicine, and so that you are actually learning these principles right from the beginning, and I think Dr. Weil always says, we don't want it to be called integrative medicine anymore. We want it just to be called good medicine, like it just becomes part of the,
like
the,
it's
the
already
fabric.
Integrated,
like it's part of the fabric, right, of what we do. Exactly, right, yeah.
Medicine.
And I think there's the section on integrative medicine at the AAP is doing a lot of work to create programs through the AAP and at meetings and so on, to bring more and more of these topics into the mainstream to teach. And the Andrew Weil Center for Integrative Medicine's website has tons and tons of CME content for all levels of people seeking it. So I think we're definitely seeing a change in direction compared to 10, 15 years ago, when I was just sort of like getting this spam email. When it came into my spam, I was like, what is this? I was like,
Thank God for that spam email.
Yeah. And I also want to say thank you so much to Dr. Max Bergdorf. Of course, he was such an amazing teacher to me, but I just remember that time when I went to him, because he had to sign off on me applying to the fellowship, and he's like, what is this? What is this integrative medicine? And I'm like, I don't really know, but I want to do it. And then we always joked about it, because like 10 years later, he was asking me about what probiotic should I use, and I was like, well, welcome to the doc side, Max. But just and all the administrators at Cardinal Glennon that have supported the clinic through the years. There's so many over the years who have supported the idea, because it is an idea, and it is definitely sort of on the cutting edge, and so very grateful for that support.
So you've gotten this support from SSM Health and through Cardinal Glennon. Is integrative medicine getting, because Cardinal Glennon is a teaching hospital with a residency program for medical students, is integrative medicine getting woven into the residency curriculum for Cardinal Glennon?
I don't think it is currently. At one point we were offering that community elective, and then the pandemic hit. And so, we kind of, all opportunities for education kind of ground to a halt. And then we got very busy, in our office, to the point that, we haven't really even revisited those opportunities. But there's always the IMR program that can be incorporated into any residency program. That's always there. Yes.
So, Dr. French, most of our guests that we have on the podcast are people who are, I don't even know how to say it, within the walls of Cardinal Glennon main campus, right? And your office is out at DePaul. So tell me about that, just so people aren't very confused. So why are you there and not here? And like, how did you get there and all that kind of stuff?
It's so interesting because, 1999, I moved back to St. Louis. I was in St. Louis. I did a little bit of fellowship at St. Louis Children's Hospital. And then I went to Northern Michigan, actually, and did a 3-year underserved commitment to get my green card as a pathway to citizenship. And then I came back to St. Louis, and I just didn't want to work. And I became Glennon Care had a locum tenens position at that time with Mark Stifler. And so I, would just go and work wherever people needed help. And so it was a wonderful way to get to know the entire community of pediatricians. And then I joined the primary care position opened up. One of the physicians left and I joined them. And so that position was at between St. Joseph's Health Center in St. Charles and DePaul Health Center. And then eventually that office closed. And so I just have always been at DePaul my entire time. And so when we, in 2017, 2018, the demand for integrative medicine was so much. And I had a 1-year wait list. And I've always been part of the primary care office at DePaul. And, but, we were starting to see that this was really a specialty that needed a team. And I, again, extremely grateful to Damon Harbison and Sean Dryden and many people who were pivotal in finding, we found this office down the hall from the other office that I've always worked at. And so we moved into that space in 2019. So it's been 5 years since we've been there. And so the team is dedicated to primary care with an integrative medicine focus, and then complex chronic illness specialty care integrative. So that's kind of why I'm there and not at the mothership, as I say.
The mothership.
Well, so how could you give us a number of how many children's hospitals have a pediatric integrative medicine program? Is that pretty common?
I should have researched that. I think it is much more common. There are several academic institutions that have pediatric integrative medicine departments. And then there are many institutions that have pediatric integrative medicine offices as part of the sort of the specialty care. But I don't have that number. I could probably find out though.
Well, I can say for certain one, at least.
For certain one.
For certain one. That's right.
I wonder who the doctor is though.
I want to ask you both, Stacey and Dr. French, the same question. And I'll start with you, Dr. French. What do you feel is the most important benefit of this approach?
I think I want to always come back to the fact that we're trying to remind children and caregivers that everyone has the innate ability to heal. So hope, I think giving hope is really, really important. And then rebuilding a trusting relationship between the family and the practitioner and the establishment. I think because especially after the pandemic, I feel like some of that has been eroded. And I think it's really important for us to empower families to trust in the process of healing, which is a team approach, and then also believe in their own ability to heal. And then also understanding that this is evidence-based medicine. And so, it's evidence-based and evidence-informed. And so if we are bringing in the suggestion of a healing modality, whether it be meditation, yoga, a supplement, a different way to eat, food as medicine is a huge part of our practice, that there's evidence behind it and that we are staying within the boxes of safe and effective, or safe and not effective. And what I mean by that is I always give the example of chicken noodle soup. It's very safe. We have no data that it's effective, but it's effective. Everybody reaches for it when they have the flu or when they are sick.
So you're saying it either works or it doesn't work, or does nothing?
Well, I say it works, but we don't always have a study to support it, is what I'm trying to say.
People just eat it. They just believe it works because it
safe
works.
And effective. Safe and not effective as in nothing is going to hurt. We have anecdotal evidence. We have some evidence to inform this. We don't necessarily have all the randomized double-blind controlled trials because unfortunately there isn't a lot of interest in studying this because there's not a lot of money in studying something that's not a drug. But, so we stay within that box of safe and effective. So that's really kind of like that, I would say, making sure that families leave our office with hope and knowing that they've been heard and seen. That's so important to us. Like when we established the mission of our office, is like families need to leave knowing that we heard their story, that their story was heard. We hope that we can help every family that comes through our office, but we understand that plan it's a master plan. Sometimes it's beyond us, right? And so we are definitely humble in our understanding of how far we can take a family, but we want them to know that they were heard.
So for me, it's a little bit different. I am very drawn to why things are happening, what's going on in the body, why is this happening, what's not working, what's needing to be supplemented, or a diet, or, what's going on in our bodies that is producing these issues that we're dealing with. And so to me, that was the best part of it. It wasn't just a Band-Aid fix. It wasn't, this is the symptom, here's a medicine, which at times it's, what we know and what we can do, or, that kind of thing. I wanted to know why it was happening and what we could do to fix it, or to at least support it, and get his body working to the best of our, our knowledge and ability, our Dr. French's knowledge and ability. And it was really personalized to Siler. It's not just, a cookie cutter thing. It was, this is what works for his body, and this is what his body's needing. And I actually have 2 children in the practice. My younger son is also seen by Dr. French. And
it's him.
And when we first started, when we first started going to her, based on what I had tried to cobble together on my own, was the same for both of them. But in reality, what my younger son needs is completely different than what Siler needs.
Well, I love too, earlier, I think all of you said that, and I know we're still evolving and this is, kind of an ongoing process, but that Siler is now at a point to some level of driving his own bus, right? So, and that you
Literally
said, right. And that you said, I am willing to do this, or I would like to do that. So are you okay to talk about some of those things? Like, what
Sure.
have you said? Yes, I want to do this, or I'm willing to do that, or yes, I think that this will help me. I want to do that.
Yeah, more excuses to get more screen time on the podcast.
All right, bring it. Sure, you got the floor.
I actually think Dr. French's method of getting kids on board is very great, because if you leave the kid out of the thing, it's going to make it feel like, okay, well, I shouldn't be hearing this, because it's like the adults are talking. It's scary. It's booga booga. But if you're including the kid in there and saying, hey, you're going to do this, you're going to do that, you're going to do this, it's like, oh, well, I mean, if that's what we're doing, it's not that bad. It's like basically what you're saying. It's like, instead of going into the corner and going like, and they just go over there and say, hey, you're going to die. Well, that's not a good example, but like, you know what I mean? It's like, tell them up front is what I'm saying.
So you felt part of the process.
Yeah, I did. It's like, you think they would tell the person they're actually doing it for. It's like, you're telling the person that it's like if you're going to buy someone or like tell them you're going to Disneyland. It's like you're telling everyone but the person you're taking to Disneyland. It's like, really? Isn't that the point?
Less surprises.
Yeah.
Is what you appreciated too.
And I think that one thing that we are so grateful to Cardinal Glennon for is that, most integrative medicine isn't accessible and affordable. It really isn't. I mean, the model is concierge type medicine.
I was going to ask you about that.
Yeah, I mean,
so
I always
that.
say I honor everyone's path. Like, everybody needs healthcare. So it's so, I think, wonderful that we can offer this, in the model of a hospital system where it's a copay, and so we take all insurances, and we never ever have ever, that's what I love about it. And it's there's such a vibrant healing community in St. Louis, which I was part of way before I became an integrative doctor, because I love going to yoga, and I've sound healings, and I've also been part of the community teaching mantra and Veda and all of this. But then I became an integrative doctor. It just was like wonderful to have all these contacts. But just knowing that there's so much out there that people can access through our office. They come to us, and then we can connect them also to a wider community of healers. And so just the accessibility and the affordability and the equitable care that we're providing, for all people of all backgrounds, people of all socioeconomic status, people of any, gender identity. I think it's really important that we're offering that in a place that's a safe space. So I think that's the other thing I just wanted to say is, we were talking about our office, leaving with hope, but also just understanding that is available.
And that's partially or fully, right? Because you're underneath the SSM umbrella, right?
Absolutely.
Because I think what you're trying to say is this type of practice, this type of medicine, it's out there. It's out there in the world in both adults and pediatrics, but for the most part, it's private practice and it's cash only.
Yeah, it's
and
fee for service.
Yeah.
Yeah.
Mhm.
And it's out of reach for a lot of our families who actually the ones who need it the most.
It seems like it makes sense. Like that it's good medicine. Like you said, you're trying to get away from the term integrative medicine, but
It's good because it's good.
it's good because it's good. Hey, we're hearing from the source here. But
I make the medicine.
well, hey, you had a part in your care path. But there have to be obstacles, I would assume. Like, I mean, can you tell us what those are? Like, is there pushback from some of the more traditional approach to medicine? You know, what that's like?
Yeah, I think, healthcare is a productivity-based model, and so there's a lot of push on seeing more patients in a shorter time, and that doesn't lend very well to our model of needing to do a deep dive into the history and really spending time with the family and coming up with these individualized plans, correct? So I think from that standpoint, again, I'm just so grateful to Glennon. We've all grown together. I used to joke like 10 years ago when I started doing it, when somebody asked me what I'm doing, I said, I don't really know, actually. I'm growing myself. Like I always would say, I'm like in the infancy now, I'm in my toddler stage, and Glennon's growing with me. And so our clinic, model has sort of evolved with us, as we've grown. And so giving us opportunity to spend more time with families and still staying within a model that works. And I think it's also just, there is a sort of negative connotation to holistic medicine, so when you talk about essential oils and, chiropractic care and acupuncture and homeopathy, and people are like, well, there's no evidence behind that. Like, well, all of that's just holistic and it doesn't really work. And I think it's important to be able to go to the literature and see that there is actually a whole group of people like that, the academic consortium that are, and the American Academy of Pediatrics and Andrew Weil Center and all these places and several places across the country that have fellowship programs that are really trying to look at this through rigorous scientific evidence. And so just kind of changing that mindset around it. I think there are still some obstacles in that.
Do you think any continued, I guess I'll use the word skepticism, is just knowledge deficit? I mean, it's just not taught. Like at the degree we probably need to be aware of, it's just not in the curriculum. So there's just a continued knowledge deficit, right?
Yeah, and I think it's, this is where, I'm a clinical mentor for the Andrew Weil Fellowship Program. So it's so nice to be in that role where, you have somebody doing the fellowship who's going into practice and helping them understand how are we going to actually apply it, right? And so starting from, bringing more of the foundational principles into obviously medical school education and residency education, but also having the fellowship programs, there are several now in the country, where a physician who's interested in this can just go and learn about it and bring it into their practice. And then also, again, the section on integrative medicine does a lot through the AAP, has a lot of resources. We have webinars almost monthly. We've got resources on the website. There's a section at the National conference and exhibition every year that's just on integrative medicine. There's so many teachers and pioneers in this field. I have to call out Dr. Kathy Kemper, who I adore, who's, I would say, the mother of integrative medicine, a great friend and mentor of mine, and so who've worked for years trying to make sure that this knowledge is out there. But I think it's a little bit of both. I think it's maybe a lack of awareness, but I think there's also sort of the mindset that we're taught that some of these remedies don't work or don't have enough evidence behind them. And so I think the advantage of integrative medicine is knowing that we're going in with an evidence-based focus.
So you mentioned the intake form and the and the wait list. Are most of your, I guess, clients filling out the wait list for, is this like self-referral, like it's parents that are wanting this, or do you have specialists who are dealing with complex patients, medically complex children that say, okay, that have an awareness of you, right? And like we've exhausted, I shouldn't say exhausted, but we're doing everything we can in a
Maybe
conventional
they're
sense.
exhausted.
Right. But
I'm
but,
exhausted.
we're doing
Yeah.
everything we can in a conventional sense, and we're just kind of right here. But hey, maybe, this approach, which isn't my forte, I don't know a lot about, but maybe if you go see Dr. French, like, does that happen? Is that a
Yes,
thing?
Absolutely. It's sort of various. I mean, I think a lot of the referrals are parent talking to another parent saying, my child and your child have similar challenges. And I saw Dr. French's office. I saw Amy McAllister, the nurse practitioner. I saw this office that offers, this different approach. Maybe you should go see them. So that's one. And then we also have referrals from other practitioners. So a lot of referrals come from psychologists, mental health therapists, occupational therapists, physical therapists who are seeing children with complex chronic illness, chronic pain, dizziness, or again, who see kids on the spectrum. A lot of the people who are the ancillary therapy service, I get a lot of referrals from them. I get from school counselors and people who, they are ones who are seeing a lot of the mental health issues they're the ones seeing the kids at school. And then we also have physicians and specialists who, like have sent a patient our way or two, and then the patients have gotten better and have gone back and said, and then they see another patient with a similar, and they're like, oh, well, maybe, that patient got better. Let's go, so we're starting to see more of that. So it's really kind of a mixture of what comes our way, why it comes our way. Yeah.
Well, I just feel like true primary care pediatrics should be more proactive than reactive, right? And like, I'm proud of our folks in Donnie Pediatrics, right? That they have a model that they do that family well-being questionnaire, and they're asking a lot of very
Absolutely.
pertinent kind of lifestyle-led questions, with families addressing some social determinants of health and other
Absolutely.
things that really do affect health. And I feel like we just can't put a high enough priority on prevention and teaching people how to help themselves, right? Because you said we have so much within ourselves that we can be doing on our own, and looking at prescribing lifestyle solutions in addition to, other things. And we have to invest that time in teaching people how to fish, right?
And we also have to change policy around these things, correct? I mean, it really starts at the highest levels. And I think the present government is really working hard on, changing nutritional guidelines in schools. And the WIC program just expanded dramatically, which is wonderful. It's going to come in the next few years. And so again, some of the, the access to, it's one thing to say, hey, you need to eat healthy. It's another thing to actually help the family understand how that happens, help give them resources to be able to eat healthy,
Right.
help them it's not easy to do that sometimes. And so
It can seem overwhelming to some people
yes,
too.
exactly. And so
Starting
that's
is half the battle.
exactly
Right there
very
with you,
well
man.
said, Siler.
Shout out to my grandpa. I stole that from him.
Oh, yes. Yeah, starting is half the battle.
Any closing thoughts?
I feel like I said most of what I wanted to say. I will say that a little over a year after we started this journey with Dr. French, Siler has made tremendous progress. At his last well visit with his pediatrician, he got 2 vaccines. He stood there and he was fearful, but he was brave. And when he got done, he told the nurse, "I apologize for last year." So to me, that was a pretty good indicator of how
growth.
well he was doing.
I don't really have anything else to say other than shout out to my Miss French. Also, my other physical therapist, Miss Lindsay. I don't know if she's also part of the thing, so I don't know if she listens to this. So shout out to you, Miss Lindsay.
She works here.
Miss Julie and Miss Barb. Why not?
And Dr. Ferguson.
And Dr. Ferguson.
Yeah, your entire team.
Mm-hmm.
Everyone that is listening to the podcast.
Everybody works so well together.
I just want to say thank you to Cardinal Glennon. I'm just, my journey in the last 25 years, just kind of growing with them, and just I can remember every single person at every single point that has been pivotal in bringing us to where we are today with our office. All the meetings I've had with physicians and administrators over the years, and all the staff that have come through our office. We've had people come work at our office and then leave for certain reasons, but every single person was important in bringing us to where we are today. And again, just a shout out to our wonderful team, because we do hard work there. We can't do it unless we have the staff to support what we do as clinicians, but also, all the families coming in and all the other work that goes into keeping it going and making sure that we continue to have a safe space. So I'm just really grateful for our model, which is, it's very unique, our model to have an integrated pediatric office under the umbrella of a hospital system. And again, just keeping it accessible and affordable and equitable. And also understanding that we are working from the premise that, this is the healing presence, that we're always turning to, that we're always depending on, and complete gratitude for the holy encounters. I'm really grateful that Stacy and Syler, came into our office, and I was fortunate to, but of course. I'm very glad that Siler was dragged into my office.
I really appreciate getting kidnapped.
You don't have to be dragged anymore, though, right?
Right.
I still do.
A little bit.
Shout out to my mom for being a very good dragger into things.
But just really grateful for these so many opportunities to connect with families and learn from them, and the healing. I always say the healing goes both ways. So I always consider myself extremely grateful and privileged, honored actually to be on this journey with so many families.
I mean, if you heal as well, then you're probably the strongest person on earth by now. Have you seen that wait list?
Yes, I'm so lucky because, I get a little healing every time. But yeah, so just grateful that we have the opportunity to do what we get to do every day.
Well, I would love to think that your opportunities are not done and that we just I know we need more and more and more of what you do, and more safe and more healing and more of everything that you've talked about. So I hope we're not done helping you do what you do.
I hope so. I mean, I always joke about the magic wand. Obviously I'd love Taylor Swift tickets and
Where do you want to be in 10 years?
I mean, I always joke about Taylor Swift as my angel philanthropist, but it's just, some sort of investment in, taking this to a larger, I hate to say center, but just where everything's under one roof, and we're really talking about a place that's healing when you walk in, and, having a garden and a kitchen, place that you can learn about nutrition, having, just drawing on the immense healing talent of St. Louis and bringing in art therapy and music therapy and sound therapy, and having all the, homeopathy and Ayurveda and acupuncture, all of it under one roof, where it's accessible and affordable to anybody, where you're not limited by your resources. Because what we do, the clinical side of it is important, but the support of having mental health services, and so having that all under one roof. And these sort of centers are established all over the country from philanthropists, who are willing to donate and support it because of a personal story that they've had. There's always usually a personal story of healing of a child, and then they want to, expand the services. So yes, that's always I'm always thinking 5-10 years ahead. So hopefully that's, I'm Taylor Swift, wherever you are.
If you're listening.
Yeah. One of those $1 billion.
Taylor Swift, you better give us some money right now.
Well, maybe the right person will hear
the right
this,
angel.
right?
Yes, absolutely.
And just don't go anywhere. Just don't leave us. Where would you like to see Siler in 10 years? I think you've had some big wins over the last year.
I believe in Siler. I think he's going to do great.
Yeah.
And he might take a different road to get there than the cookie cutter way that, most children get to. But I'm excited to see what ends up. I see several potential exciting paths for him. So
would you have had that same confidence a year ago?
No. Jinx.
No.
Jinx.
Which I feel like that
right
speaks for itself.
Right.
So, Well, thank you all for taking time with us today.
Thank you so much for
Yeah,
inviting us. And
You're
thank you so
telling me?
much.
Yeah. Thank you.
Yeah.
You're amazing.
Thank you, Siler.
Thank you for
Literally,
sure.
yeah,
The
on a
strongest-
podcast. Me.
one
on
of the
a podcast.
strongest
You
people I
on
know.
a podcast. You can cross that off your bucket list, even
My
if it
non-existent
wasn't
bucket
on
list.
it.
Yeah, there you go.
Yeah.
It's
I
going
can
to be
add
the
it to the
top
list and then
thing.
cross it off.
Like,
There you go.
that's right. I do that. You know, add things
Yeah,
to the list so
we
can
definitely
cross
want to
it
give a
off.
shout
I'll do
out to
that.
Siler's strength
Yes.
and such
Thank
a
you.
wonderful human being.
The strongest person I know.
Me? I don't think you know very many. You should go to the gym. You'll find someone immediately.
We hope you enjoyed this episode of The Glennon Factor. Make sure you follow The Glennon Factor and leave us a review wherever you get your podcasts. Visit glennon.org if you would like to learn more about how you can support Cardinal Glennon kids. And while you're there, feel free to share any feedback or episode suggestions on our podcast page. The Glennon Factor is recorded and produced by SSM Health Cardinal Glennon Children's Foundation. This is cool. And the fact that we've got this going on,
Right.
this is cool. We did it.
We did it.